Welcome to Living Your Best Senior Life. I'm Nancy Andre from Wingate Living. Getting older doesn't necessarily mean slowing down. It means being thoughtful about how we take care of ourselves so we can continue to live healthy, active, and meaningful lives. Today, I am very excited to welcome Dr. Jenny Liu, founder of Innovare Medicine. Dr. Liu brings more than 20 years of clinical and academic experience from Mass General Hospital and Harvard Medical School. She's board certified in both internal medicine and nephrology and has cared for patients ranging from routine to preventative care to very complex medical conditions. Dr. Liu, welcome to Living Your Best Senior Life.
Thank you, Nancy, and it's wonderful to be here.
So happy to have you here. So before we get into the nitty-gritty and lots of issues that we want to talk about, I'd love to start with if you can tell me a little bit about how becoming a physician, how that happened, what inspired you, how did this come to you?
Yes, so I always, fascinated about science and medicine.
Okay.
So partly because my mother has worked as a medical professional. So when I was young, both my parents pursued their career. They're very busy. So I was largely raised by my grandparents. So in my elementary school, so both of my loving parents, and they passed away from disease. So within a few years apart. So one from the stomach cancer and one from the heart disease. So I was very devastating. At that time, I told my mother, I say, I want to be a super professor, whom I can treat the disease and really to help people, fighting the disease who cut my grandparents' life short. So that childhood dream has really driven me to do the things I was doing for many years. So I went to the medical school and I did my PhD research on molecular biology, followed by my postdoc training on vascular biology and the kidney cancer at BI Deaconess. And then I back to medicine training. I did my residency training and my fellowship in nephrology at Mass General. Then I joined Mass General faculty in about 20 years ago. So from there, I come all the way, now I'm here and driven by my childhood dream, just want to take care of patient and bring the happiness, bring the longevity to their life, which unfortunately my grandparents were not able to have.
I love that. That's amazing. You spent many years practicing at the academic medicine at Mass General and Harvard Medical School. What did that experience teach you about caring for your patients?
Yeah, so working academic medicine is amazing. It's a great opportunity. I think the best thing I learned is you're constantly learning and you strive to be the best. So while at Mass General and Harvard, so I had the privilege of caring for patients, have anything from routine medical issue to very complex illness. So what that had taught me, be a good medicine, practice good medicine is not following the guideline. You have to treating the patient as a whole.
Yeah.
You understand, what's their life goal, what matters most to them, and you do a good medicine. That's what I learned.
Gosh, I love that. And that's ultimately what led you to create Innovare Medicine?
Exactly.
Okay.
So I created Innovare Medicine with the goal I can bring the depths and the resources of academic medicine, which I had, and really do a good job, treating my patient with a very thoughtful mind.
Gosh, I love that. Okay, so Innovare Medicine, now what I wanted to ask you about concierge medicine, which is what you're focusing on now. Is that something, I know it's something people hear more and more about, but they might not truly understand what that means. Can you tell us what is the definition of concierge medicine?
So concierge medicine is a membership-based healthcare model.
Okay.
gained a great popularity in the past 10 years. So it basically provides essential access, time, and continuity of patient's care.
Okay.
So I think at the core of concierge medicine is really try to restore the continuity, the time, which we cannot provide it at the current modern practice.
Yes. Oh, yes, that is so true. I'm experiencing that now personally. So, how is the experience different from a traditional primary care practice, would you say?
Mm-hmm. The primary care practice is right now facing a great challenge. Mm-hmm. It is not because our physician, they did fantastic job. It is because the system and they are working within. They have a huge patient panel, they have very limited patient time, mm-hmm. and they have a huge administrative burden, which make them very difficult to do a good job, to spend time with patient, mm-hmm. and to build up very important, the trust and the continuity of the care they can provide, and which is so important for the overall quality mm-hmm. of the medical care.
Oh gosh, yeah.
Yeah, as a concierge medicine, so we have the advantage. We manage a small panel of a patient, and you have plenty of time for patient. You do them better. And
You're not, once they get in there, rushing them out.
No.
Okay.
They have plenty of time. They have access to you when mm-hmm. the problem arises, and then you have a time to build up a long-lasting, trusted partnership with your patient.
Because it is all trust. I mean, that's what it's.
Exactly.
The patient trusting the physician that's caring for them.
Exactly.
So, interesting. Okay. I will tell you, I noticed just by reading all mm-hmm. the information and reading about Innovare Care, mm-hmm. The emphasis on the time, the continuity, and having one physician, that one physician yeah. being you,
yeah.
who understands the whole picture.
Yep.
As we get older, that's obviously very important,
yes.
right? I mean,
yes.
it's because we start to have different yes. things that are yes. happening and different medical conditions that, we're getting diagnosed with. So yes. you would be that main person that is connecting all the dots together.
Absolutely. Okay. So, as you said, Nancy, patient problem become more complicated yes. with time, and they see multiple specialty. And as their concierge care doctor, I know them better, and I know what their baseline is, so I can recognize subtle issues, subtle change timely, mm-hmm. and then arrange the visiting, arrange the evaluation, okay. and also I can make a coordinating with the specialty care.
So you have a group of specialists that you
yes.
can at any point in time, so they don't have to go through the whole loophole.
Yes.
Okay.
Yes.
Okay, which is huge.
Yeah, exactly.
And the average person as we get older does have these several specialists. We've got the cardiologist, the yeah. nephrologist. Lots and lots of different doctors, but you are that person that's coming in there and literally managing. Are you getting follow-up information from them once they go to a specialist?
Yes. So that's a very important aspect you raise it.
Mm-hmm.
In modern medicine, there's so much advance. So specialty care has gained such a popularity,
right.
and we have utilized it greatly. However, that unintentionally created another level of fragmentation of care,
okay.
which is our patients sometimes get lost with their specialty. So they do not understand, yeah. What's those, focused evaluation regarding their particular medical issue.
Okay.
So therefore, that raise that demand of new primary care mm-hmm. doctor at a high level. So we cannot function as provide just routine primary care.
Okay.
We have to be capable of understanding and oversee the very comprehensive specialty care
okay.
At the level. And then we can integrate all this information and helping our patients to make a right decision. So wow. It is our primary care doctor, going to play a central role to always remind people and what is the whole picture of our patient in the view at all times.
Yeah, yeah, that's huge. I recently, and it seems like, again, as we get older, and I experienced my own personal issues, but I went to my primary care, which I was not able to see. I have actually not seen her in years because she's too busy, but handed me off to a lovely nurse practitioner, but doesn't really know and understand who I am.
Yes.
And I was only able to discuss one issue.
Yes. Yes.
And I said, you gotta be kidding me. This is crazy. You're my doctor's office.
Exactly.
But they said no. And for insurance purposes, you came in here for your back. Right. We're not gonna talk about fatigue. And I'm just giving, throwing examples there. So you don't do that.
I don't do that.
Okay.
As a concierge practitioner, right? So we follow problem through, right? We look at the whole picture.
I love that.
Yeah. Yeah.
It's huge.
Not a single
issue. It's not
issue.
just single patient.
Yeah.
Okay, let's talk about prevention.
Yeah.
So many of us, they don't go to the doctor. We don't go to the doctor until something is wrong.
Yeah.
What would you say to someone who feels healthy and thinks, why do I need to see the doctor?
Yeah.
What's the reason? Like, I'm doing good. Like, are there particular health screenings or conversations that become really important as we get older?
Yeah, this is a very common thing, actually.
Okay.
So my suggestion is, when you feel good, that's actually the best time
to go.
You get a doctor.
Yeah.
You know why? Because all those diseases, the high blood pressure, atherosclerosis, right, kidney disease, they have been developing, silently for many years. By the time you start to have a symptom, it's really too late. So let the doctor to assess you risk factor and manage it. And while there's plenty time, we can modify it.
Yeah.
So I think that is very important.
Yeah. Do you think people are afraid?
I do think so.
Because that's what I noticed. I have my dear sister who I just adore, my best friend. And she sees a specialist, but she doesn't feel the need. Why? What's the point? And I said, because they're gonna be checking everything and monitoring and managing your health care, and so I
absolutely, especially for I notice, not try to be stereotyped.
Yeah.
So I notice a lot of my male patients, really afraid of. So they don't want to know. Yeah. So I think that's a misconception.
What I don't know won't hurt me, right?
No, yeah, absolutely. So I want them to understand, medicine is not finding your problem, treating your problem. Actually, nowadays, we try to find you risk factor. We prevent you from getting sick. It's not that we try to find trouble.
Yeah, that's so awesome. Okay, I definitely want to touch on this. You have a special area of expertise in nephrology and kidney health. I don't think many people really understand what their kidneys and how important a role they play in the whole body. Why should older adults pay attention to kidney health? What is the major thing behind this?
Yeah, kidney is a remarkable organ. I love this. I love kidney. So, and the kidney disease also very, underestimated, right?
Okay.
Overlooked, right? So people keep saying, I feel well. Why even looking for kidney disease?
Why are we looking for problems,
exactly.
Right?
Yeah, the problem is that kidney disease don't show signs and you do not know. So as an average, 1 in 3 people over age 65 actually has a kidney disease. And many of them does not aware of that.
What is over 65?
Yeah.
Wow.
1/3 of them.
Wow.
And a lot of time we have acute kidney injury, we don't even know. And there's so many insulting factors can stress our kidney. And kidney is so important. So kidney,
kidneys are ultimately responsible for
lots of things. Like a kidney constantly working very hard, tirelessly. It filters 180 liters of blood each day. And it regulates your fluid, regulate your electrolyte, and it secretes hormone to regulate the bone health and regulate the blood cell production. So it's very, very important.
Wow. Okay. That's why if somebody needs a kidney, this is my non-clinical understanding. If somebody needs a kidney donation, it's huge
Yes.
to maintain their body working, right? I mean, that's, wow. How are kidney health and heart health connected?
That's a great question, Nancy. They are extraordinarily connected, interconnected. Okay, so the heart, you can't just talk in one, a kidney without talking about the heart, vice versa.
Okay, so they really
connected. Heart perfuse the kidney, and kidney go back, regulate the volume status, electrolyte, affect the heart.
Okay.
So when the heart failed, the kidney deteriorated. When kidney function declined, and there's an increasing substantially the risk factor for cardiovascular disease. So we have a terminology specific for that. We call it cardiorenal syndrome or renal cardio syndrome, just to highlight the close interaction between these two organs. So as a nephrologist, so I'm glad I have a background in both internal medicine and nephrology, and that has greatly shaped my way of practice. So when I look at kidney, I'm not, look at an organ, with an abnormal problem, laboratory problem. I'm look at how the kidney affects the whole body physiology, and how the individual's cardiovascular health. And that is the most important thing.
Interesting. I had no idea what a huge role the two play together.
Yes.
So, wow. Let's talk about cardiovascular health, because it's pretty much on the news every night.
Yes.
What are some of the mistakes, the biggest mistakes, that you see people making when it comes to protecting their heart as they age?
I think the most misconception is, they feel great and they think their heart must be fine. So, however, as we mentioned a little bit early, high blood pressure, atherosclerosis, they develop very early on. By the time a person starts to develop a chest pain, stroke, heart attack, that process has been going on for decades. So, therefore, we should really pay attention to the early management, modified all the risk factors. And the second thing people hasn't paid attention is we turn to focus on one number, one thing, like a cholesterol. And we overlooked many other cardiovascular risk factors. So things are all interconnected.
Wow, that's unbelievable. So now that we're talking cardiovascular, I want to go back to the blood pressure and cholesterol.
Yeah.
What numbers should people actually be paying attention to? And should those targets change as we get older?
Yeah, it's very interesting. That's a great question, Nancy. So very, very interesting. Actually, the number, the target keep changing. Last year, the blood pressure was labeled for most people is less than 130, 80. And this year, they become 120. So my view is this target has to be individualized, especially for our frail elderly.
Okay.
So for example, the blood pressure, how to target the blood pressure is really depends on the individual patient. Does that patient have severe cerebral vascular disease, which they demanding high perfusion pressure for the brain to function? Are they frail, and they certainly have a high risk of a fall and fracture, that going to dramatically affect their quality of life. So I think we should really individualize. And
so it's not just you're 58, you're this weight, your blood pressure should be this number on the top and this number on the. It's really it's having that physician that has a full understanding of everything that's going on with your health, connecting the dots.
Yes.
Dotting the I's, crossing the T's,
yes,
and managing it that way.
Yes.
Right?
Yeah, I think the thing we have to emphasize, we're not treating a number. We're not treating a specific number like blood pressure, like the LDL, the bad cholesterol. We are really treating the patient. And we want to know what's the best optimal target in that person. And the principle of medicine, the first principle of medicine is do not harm. So we have to make sure our frail elderly population, had something really carefully assessed and managed.
Wow. Okay. God, you're brilliant. So another huge issue that comes up frequently for older adults is medications.
Right.
Many seniors take several prescriptions from different doctors. What is polypharmacy and why can it become a concern?
Yeah, polypharmacy, from the terminology, it is multiple medication.
Okay.
So when they're getting older, you can imagine they have seen many doctors, many specialists, and many of them probably prescribe the medication for a good reason. However, with time, those medication, those lists get long and long, and nobody has the time, to really take a look, step back, and ask the question: do you really need all of this? Is your problem have been resolved? Is there any interaction between that medication and this medication?
Right.
So that's the time is causing a problem. The more medication our senior has it, and the high risk they're going to develop a side effect. Particularly, they fall, their blood pressure dropped, they become delirium, and the kidney got injured. So all those things can be preventable if we take a meticulously review of their medication.
Right. Should they bring their medication list to every appointment? Because you constantly hear this, but I know when I was helping to care for both my mom and dad, and they would just pack them all into a large Ziploc bag, and it was a little bit of a, disaster.
Yes.
And I felt bad for the doctor. So,
Yes.
But what should everyone do? What's something relatively simple for a patient that's managing their own medicine or a caregiver that's managing it on behalf of them?
Yeah. So that's a very important question, right? So I think the medication is the most important medical information, and we want to make sure as accurate as possible. So I do encourage every patient should bring, their medication list reviewed with their provider. And ask the question: do I still need them? Right?
That's a good one.
Yeah. And does a certain medication cause you a problem I'm experiencing? Yeah. And something you took maybe 40 years ago, do you still need that? So I have an example. I have a patient, he has ADHD diagnosis when he was in the 30s. Now he's in 70. He's still taking that ADHD medication.
Are you kidding me?
And it drives his blood pressure like a yo-yo. So then you think about, do you need it?
Wow. Is this necessary? Yeah.
Yes, exactly.
So it's also, I think a lot of this from what you're saying has to do with the time factor that right now, our medical system, which it is a little broken.
Yes.
Well, it's a lot of broken, unless people have you and then it's not. All right. So let's just talk about avoiding illness. Any recommendations or suggestions you can give to the audience so that they can maintain independence and obviously quality of life from your perspective?
Yeah. So avoiding illness is such a big topic, So I think we should do a little early, probably a lot early. So for example, we really need to building our physical reserve and our cognitive reserve from early on.
Yeah. And that's huge. Okay, let's talk about families.
Yes.
Sometimes we have adult children becoming very concerned about a parent's health before the parent is willing to acknowledge something has changed. What are some signs that a family should become a little bit more involved in their loved one's healthcare?
Yes. So that's very important with family involvement. So in my practice, my experience is, when family involved more, and outcome usually much better. than
Yes.
patients being alone.
Okay.
So I encourage family to get involved.
Okay.
So they are usually the first one. They know patient's baseline. They can recognize early change of their baseline and cause medical attention.
Right.
So I encourage them to continue to do that. But also, I do not assuming every change of the little sign is due to aging. So I want them to thinking, certain medical condition could contribute to that, and we need to treat it and reverse the temporary status decline.
Okay, that makes sense. All right, so we just have a couple minutes left. If you could give our viewers 5 questions they should ask at their next doctor's appointment, what would they be?
Yeah. So first, I want them to ask their doctor, not treating my disease, how you do, you can keep me stay healthy, independent, like what I now in the next 10, 15, whatever the years you give the doctor.
Yeah.
And the second, I want them to ask doctor to review their medication.
Okay.
And third, I want them to ask a doctor to identify, to work with them, to find out what's their risk factor in their daily life.
Okay,
and
that's huge.
Yes. And fourth, I want them to discuss with doctor about their lifestyle modification, their nutrition, their stress, their exercise. I think those are very important component going to make a difference and to contribute later on their independence.
Yeah, which is what we all want to do.
Yes.
Gosh, you are just fantastic. I am
Thank you, Nancy.
so excited that you have been here today with us. Before we, it's been so informative. We've covered so many things in a very short time. I think one of the biggest takeaways today is it that healthy aging isn't something that becomes when we develop a health problem. It's something that we can work on continuously when we have good medical care, healthy habits, and a strong relationship with our healthcare providers. So thank you so much for joining us today on Living Your Best Senior Life. I look forward to bringing you on the show again. And thank you everyone that took the time to watch. Dr. Liu is a wonderful resource, a fantastic physician that Wingate works closely with. I highly recommend if you're ever looking for a concierge doctor. So thank you. And have a wonderful day, everyone. Remember, if we are all take a little bit more time and be a little bit more proactive about our health, it's going to put us all in a much better place.
Absolutely.
Yeah, so
thank you.